there's effective preconception care, the chances of complications and poor outcome during pregnancies will be reduced. So preconception care is very much important and vital to maternal health and even the family health. So this course is under family health, okay, because when plan is made very well, possibility of failure and problems will be reduced. So that is preconception care. All right, preconception care is an individualized care for people considering pregnancy. Preconception care is an individualized care for people considering pregnancy. That is, the approach you use for one person who wants to get pregnant is different from the approach you are going to use for a different woman who still wants to get pregnant, because they may have different problems and they may come from different background, okay, and they may have different needs, okay. Like for example, a woman who wants to get pregnant, who is lovely living with her husband happily, is quite different from a woman who is under personal abuse, or under physical abuse, or any other form of emotional turbulence. So that is why the approach is an individualized one. You need to show empathy, you need to show understanding to these women who wants to get pregnant. Okay, so we said that preconception care is an individualized care for people considering pregnancy. It focuses on reducing morbidity and mortality for the patient and the fetus, and also increasing the chances of conception when pregnancy is desired, and providing contraceptive counseling to help prevent unintended pregnancies. It focuses on reducing morbidity and mortality for the patient and the fetus. That is, it reduces maternal death and fetal death. It also increases chances of getting a baby. Like it increases the chances of conception. It increases the chances of a woman to have pregnancy, okay, when desired, okay, and then so providing contraceptive counseling and services when the woman do not want to have pregnancies, in order to prevent unintended pregnancies. Okay, providing quality preconception care is the responsibility of all primary health care clinicians. Okay, so let's look at importance of preconception care. One, it reduces maternal and child mortality, like we said earlier. It prevents unintended pregnancies because the woman and the husband plans when they want to have pregnancy. When they don't want it, they go for contraceptions that are effective and reliable. Also, it prevents complications during pregnancy and delivery years. When a woman has been assessed and her likely risks are identified, take for instance, maybe she is a woman who is an addict to smoking, and she comes for preconception care, and she was counseled and told to reduce the smoking and reduce to zero alcohol intake. Now look at the effect on the baby, which can lead to fetal alcohol syndrome, spectral syndrome. Okay, and she understands the effect of alcohol, preterm delivery, preterm labor, and all that, which are complications, and she reduces this and or totally avoids it or prevents pregnancy at that time. You will see that the chances of having complication in that pregnancy will be reduced. Also, it reduces chances of birth defect. Yes, like the women are now counseled on, especially those who are at risk for neural tube defect. They will not start on time to take folic acid supplements and other supplements to help them prevent this neural tube defect, because it has been identified through the preconception care period, and they understand and they comply to the treatment regimen, and this will help prevent birth defect in the baby. It also prevents neonatal infections. Yes, because the mothers are screened for STIs, and likely infections that can cross placenta are also treated before the woman takes in. Another important is that it prevents underweight and stunting. Yes, because the family now plans when they want to have a baby and when not to have a baby. It gives them chance to accumulate resources before they can give birth. As such, the baby will not suffer from malnutrition because they already planned this pregnancy. Okay, then it prevents vertical transmission of HIV and AIDS. Yes, during preconception care, the woman is educated several areas, including HIV and AIDS and other related STIs. Now, if she happened to be HIV positive patient, and during the preconception care, she's meant to understand, then the patient and the healthcare provider can plan when she can take in. That is when the maternal viral load of the virus is low, she can take in. And all throughout the pregnancy, you already know that she's positive. Then antiretroviral drugs will not be given to continue to reduce the viral load. And other precautions will be taken to make sure that the baby do not get the virus. Unlike when she is not identified during the preconception care, or she didn't attend the care was not provided, then she takes in unknown to her, she may also increase the risk of the baby having the virus. So these are the importance of preconception care. Now let's look at areas covered in preconception care. That is the area this preconception care focus. First, talk about reproductive plan. That is has to do with childbearing. You should identify patients' childbearing goals. How, when, and what time does she really want to give birth? Screen for risk factors that can impact future pregnancies. What are the likely risk factors that is in this woman that can affect her having a healthy baby? You identify them through screening and other necessary investigations. Then provide interventions to help patients enter pregnancy in an optimum health. Take for instance, maybe she has diabetes and she really wants to take in the near future. You will continue to control the sugar so that it will be able for her, so she'll be able to take in without having issues of macrosomic babies and all that, or the baby having hyperinsulinemia or preterm delivery. Okay, so you plan ahead, okay, because you have already identified her reproductive health goal. Okay, then an individual's childbearing goal, that is reproductive plan, should be considered for discussion at each visit, regardless of their reason for the visit, because their plans may change based on life circumstances. So you should continue to talk about this. Reproductive plan discussions with individuals who want to become pregnant or may become pregnant should include assessing risk. You have to assess the risk, which include the age of the woman, her health condition, her obstetric history, what has happened in the past when she was pregnant, then family history. By the time you put together all this, you will not be able to have a very good, clear understanding of what might likely happen in the future if she decides to take in. Then you now make plans to put these conditions under control before she can now go in for pregnancy. Another area this preconception care covers includes family planning. Comprehensive contraceptive services should be offered if an individual is sexually active or is having penis in vaginal sex and still wants to prevent or delay pregnancy. You will have to provide counseling to help this couple choose a contraceptive method that will work best for them. Okay, this couple don't want to have a child for a very long time, and yet they want to have penis in vaginal sex without having the woman pregnant. You also have to provide care based on family planning that is good, that will suit them throughout this period of time. Okay. Another area covered, like we said, is this family plan is very, very important. Counseling should be a place for explanation on the different family planning methods, especially long-acting reversible contraception, which is safe and effective for most individuals, including adolescents and people who have never given birth. Routine counseling about emergency contraceptive methods, and provision of emergency contraception when needed should also be components of comprehensive planning services under the preconception care. Okay, so you have to talk about more on family planning for this couple who want to be having intercourse without having babies as long as they wish. Okay, then we also talk about family planning method and also emergency contraception should in case it occurs. Then another area of preconception care is oral health. Oral health. Evidence shows an association between periodontitis and risk for adverse outcome. Yes, some research has proven that periodontitis occurring in the pregnancy, or a woman who has periodontitis have a greater chances of having preeclampsia, preterm birth, low birth weight babies. Okay, so there's an evidence on this. So therefore, oral health should be taken adequately. It should be taken as a priority in preconception care, and women should care for their mouth and all the structures therein. In addition, oral health in individuals who are pregnant has implication for infant oral health too. Okay, for example, primary and permanent teeth begins to form in utero, and bacteria that cause tooth decay primarily pass from parents to child postpartum. So there is also an evidence that is proving that organism that cause tooth decay can also pass from the mother to the baby to start dental caries in the newborn. So that is why you need to talk to them for the importance of taking good care of their oral health. It is very much important. The other area is covered that include prevention of defects, especially neurotube defects. All individuals of reproductive age considering pregnancy should be advised to take a daily supplement of 400 to 800 milligrams of folic acid and consume a balanced, healthy diet of folate-rich foods. This is to prevent neurotube defects. Folic acid supplementation starting before conception and continuing throughout 12 weeks of pregnancy reduces the risk of neurotube defects such as anencephaly, spina bifida, and encephalocele. Another area covered in preconceptive care is immunization and medication use. You will have to talk with the woman about immunization, ensure that she has completed her tetanus toxoid immunization schedules. Okay, then use of over-the-counter drugs. You should really talk to her when she plans to take in that some drugs are highly contraindicated during pregnancies, that she shouldn't take drugs without healthcare provider directive or prescription. Okay, then you also counsel her in everything about immunization. Then areas also covered by preconception care includes mental health. Mental health assessment should be included in preconception care and should be a routine part of wellness screening. Mood and anxiety disorders are prevalent among people of reproductive age, and there is a high prevalence of new psychiatric illness or relapse of a pre-existing diseases during pregnancy. So controlling depression and anxiety disorder before pregnancy may help prevent adverse outcome during the intrapartum and postpartum periods. When women who are prone to depression or other psycho-related issues, when they are under control, when they are counseled and the risk factors are reduced, it reduces the chances of these women having this condition when they are pregnant or after delivery. So preconception care also goes to that point to identify those who do have mood swing, anxiety related conditions, depression. When they identify these women, they take time to talk to them and to make sure these mood and anxiety disorders are reduced so that they do not quickly move to psychiatric illness or relapse when they are pregnant. Okay, so that is one thing that happened also in preconception care. So this is also taken care of. You have to evaluate the woman for these conditions through adequate history examinations. Then another area covered is behavioral health. It is also important to address behavioral health and lifestyle risk. This includes alcohol, tobacco, and substance use. And also not only identifying these conditions, but also providing resources and support for lifestyle modifications. Remember, alcohol use in pregnancy is the cause of fetal alcohol spectrum disorder, which is a range of effects that include physical problems, behavioral and intellectual disabilities that can have lifelong implication of the baby. So the women need to be, the mothers who want to be pregnant or young teens who want to be pregnant should be educated on this, that alcohol has a very, very negative effect. All these substances and they are very, 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 very deadly during pregnancies because they have a very bad effect on the babies. So when they are intimated, they will also have to reduce the chances too. Tobacco smoking in pregnancy is also associated with numerous pregnancy complications, including spontaneous abortion, stillbirth, low birth weight, preterm birth, placenta previa, placenta abruption, cleft lip and palate, and an increased risk of sudden infant death syndrome. Okay, see the effect. Another area covered during preconception care includes other lifestyles and occupational risk. Yes, and certain lifestyles put you into trouble or put you at greater chances of having a particular disease or problem, including occupational exposure. Exposure to certain chemicals can be a threat to your life or the life of the unborn. These include occupational hazards or exposures, sexually transmitted infections. You should regularly assess sexually transmitted infection risk, providing counseling and immunizations to prevent contracting STIs, and provide indicated STI testing and treatment. So you should continually do this in the preconception clinic. You should take time to assess this woman for this and to make sure they are under treatment. And individuals' lifestyle factors can directly impact a partner's pregnancy. These factors include tobacco smoking, which exposes the expectant individual to secondhand smoke and potentially leads to negative effects such as low birth weight, intrauterine growth restriction, preterm birth, and increased risk of sudden infant death syndrome. An individual with an untreated or uncontrolled sexually transmitted infection, including HIV, can put their pregnant partner and the fetus at risk for pregnancy complications and further morbidity. what we're trying to say are some lifestyle risk, some lifestyles, like the partner, maybe the male who smokes. The wife might not be smoking, but the partner smokes or takes alcohol or any other risk, or goes out to have sex with unprotected, can endanger the can endanger the life of the mother of the child who is pregnant, and can also put the baby in utero in trouble because of second-hand smoking. She smokes where the wife is. The wife is a second-hand smoker, or he sleeps. He goes out to have intercourse unprotected and comes back to have sex with the wife. These risk factors can have a significant effect on the wife and subsequently on the growing fetus. Another area covered in preconception care includes physical and emotional abuse. Physical and emotional abuse. Appropriate evaluation, counseling, and treatment for physical injuries and psychological traumas should be offered. If appropriate, individuals should be provided information about community agencies specialized in abuse, including counseling, legal advice, and other services. This has to do, maybe the woman is being abused by the husband, either emotionally or physically. You need to attend to the injuries if she is physically abused, and you need also to provide support and counseling if she is emotionally traumatized. Then, if local authority permits, you can connect her to agencies that specialize in handling abuse, okay, and other legal advice. Okay, so you have to really identify it, because most times women who are undergoing emotional abuse or physical abuse might have a poor pregnancy outcome because they are not emotionally stable, and these can be an enabling factors that can make them go into depression or postpartum blues or postpartum depression or postpartum psychosis. Okay, so you need to identify this, and intervention needs to put in place to avoid this occurring. Also includes interpersonal violence. Interpersonal violence. You should consider discussing intimate partner violence and coercion. Okay, you should consider discussing intimate partner violence, coercive relationships, and you should help promote respectful and consensual sexual relationship. Yes, even though they are married, the woman or the man should consent when it comes to sexual activities, and also should have respect for each other and not under violence and coercion. That's what we're trying to say. All right, let's look at the last area: infertility and subfertility. You should check out for anatomical variations, behaviors, and environmental issues which can affect individuals' ability to contribute to a successful conception. Here you have to invite the man and the woman, because maybe they may have having challenges on conception. You will have to carry out extensive examination and evaluation to find out the likely cause of this infertility or subfertility. It can be anatomical, and maybe due to structured problems like ovarian cysts in women, or excessive thick mucus production, or varicocele in the male, epididymitis in male might be the problem. Okay, it might also be as a result of environmental factors surrounding the man, such as use of over-the-counter drugs. Some of these drugs, like tetracycline, many of them have effects on the sperm. Many of them have effect on the cimetidine. Okay, so all those drugs, steroids, okay, they do have effect on the sperm production, and should be looked into. Then tobacco use, exposure to environmental hazards such as ionizing radiation, radiation heat, pollutants in diet, lead, mercury, and other occupational chemicals, then having excessive stress can impact on the sperm morphology. You see? Then also high body mass index may reduce fertility, with overweight men having greatest risk of erectile dysfunction. So you need to really examine the couples, look into the environmental related risk in their jobs, exposures, and actually put into consideration anatomical problems. So by the time you've carried this extensive evaluation and assessment, you come up to what could be the cause, and interventions will now be given so that infertility will be reduced and sub-infertility also solved. So these are the areas of preconception care. In summary, preconception care covers reproductive plan, family planning, oral health, prevention of defects, immunization and medication use, mental health, behavioral health, other lifestyle and occupational risk, physical or emotional abuse, interpersonal violence, infertility, and subfertility. So these are the areas of preconception care. And we say that preconception care is an individualized care for people considering pregnancy. It is an individualized care for people considering pregnancy, and it focuses on reducing morbidity and mortality for the patient and the fetus, and also increasing the chances of conception when pregnancy is desired, and providing contraceptive counseling to help prevent unintended pregnancies. So that is preconception care. Thank you very much.